Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start on your day. I'm letting B12 melt in my mouth. Okay, let's say hello to a few dear friends here as you come on. Brahim, Portland, Oregon. How are you, buddy? Mike, Norland. And let's see if Andrea comes in that Trinity. You guys, Andrea, Niagara Falls. Sandy, Fergus Falls, Minnesota. Kevin, our dear friend from Oshawa. John, our friend from Elgin, Illinois. Janice from Brampton. Nativity. You guys just make me laugh. Fran, Orangeville. Rain Cloud, how are you? From Michigan. Lynn from Aurora. Georgie. Halifax, Nova Scotia. Karen. Little Britain. Nellie. How are you? And who is that? Alain, how are you? Nina. Deb from Timmins. Ruth. Burnaby. And Wendy from Markham, good morning. Sherry, Mississauga, Gary, Bolton. Sandy, Vancouver, Washington, good morning. Cecilia from Sudbury, where's that? Madeleine, Kippawa, Quebec. Dave, Cardiff, Yvonne, Petawawa. Joanne, good morning. Marilyn, PEI. Rosalinda, your scroll wasn't working, and I couldn't see that one. Nick, it gets up a little higher, guys. Nick from our staff, Brenda from Bancroft, Suzanne, good morning. Bonnie from London. We love you guys. You have no idea. Judy, Port Perry, Yolande. How are you? Laurie, Cambridge, Dave. And Janine, West, Kelowna, Elaine, Carol, Wasaga Beach, Kathy, Port Perry, Deb from Timmins, and Cheryl, you guys are wonderful. Patricia, a couple more and then we'll get going. Dave, good morning. Diane, from BC, Kristen, Saskatchewan, Judy, Teresa, Dunedin, Florida, Rita, and Guylaine, bonjour, and Rosa Morial. How are you, Rosa? Okay, guys. Hi, Sylvie from Sault Ste. Marie, bonjour. And guys, we love you dearly. Okay. I got 9 different studies. I don't know how many I'll get to, but let's start, okay? Let's start. I think I touched on this the other day, but I'll go over it again because just to comment a bit, okay? 2 new studies on vitamin D, we'll get to that. 100% on autopsies of MS patients, okay? This is a study. I bet you're not going to read this anywhere. 100% of MS patients had parasites. 100% on autopsy. Wow. MS, okay? A lot more MS today. One thing about MS patients, okay, this was a study done on vitamin D. The higher your vitamin D, your lower risk of MS. So we see a lot more neurological diseases than we used to. Not that MS hasn't been around for a long time. It has. ALS, Lou Gehrig's disease, been around a long time. Parkinson's, been around a long time. But the numbers are up, folks. The numbers are way up on those conditions. So MS, 2 things. 1, the sun, vitamin D. 2, okay, parasites. What's that mean? Leaky gut. Because, guys, everybody, you, me, your neighbor, your dog, well, yeah, your dog too. Parasites are part of life, and you can't see them. They can get into your system, but at the end of the day, you've got an immune system that is meant to handle parasites. But if you've got a leaky gut, you don't have the microbiome that you should. If you have a dysbiosis, which is an imbalance of good and bad bacteria, where you have more bad guys than good guys, the barrier between your gut and your blood is compromised. What happens? Things get into your blood, can get into your brain. Because, guys, your gut-blood barrier is very similar and very much connected to your blood-brain barrier. You've got an enormous capacity to fight things, okay? You do, including parasites. How do they get into your brain? Leaky gut. They start in the gut. And we talked about this even yesterday. On Question and Answer Monday, we talked about the importance of even your stomach. You see, one of the big parts of your immune system is your acidity in your stomach. It kills bacteria. It kills parasites that come in from your upper respiratory system. You touch your eyes, your nose, your mouth. That's why I love the invisible mask of vitamin A, guys. Okay? So, 100% of MS patients, according to this new study, had parasites. Leaky gut, leaky brain. Important, isn't it? Okay, study number, well, I actually talked about vitamin D. Let me do the other one on vitamin D. So, high doses of vitamin D slow the progression of MS, okay? High doses of vitamin D. Here's another study on vitamin D and cancer. Might as well hit this one because we're talking about vitamin D. Guys, for, anybody that talks about vitamin D and does it in a negative way, I get a migraine. Your immune system doesn't work without vitamin D properly. You don't work properly without vitamin D. You are a human solar panel. Okay? Every cell in your body has receptors for vitamin D. Okay, here's another study. Vitamin D helps people survive when they've been diagnosed with cancer. Survival rates of cancer patients goes up when they are taking vitamin D. So you got anybody in your family, friends, your circle, I talk to a lot of people, as you guys know, and I was in practice for a long time. It's really, really important to understand this. Okay? Really important to understand this. Everybody needs vitamin D. Okay? And if anybody ever asks me questions about cancer, some people, they're not open to anything. Okay? Now, lots are, but some people, they get cancer, their doctor or their oncologist or whatever says, don't take any vitamins, don't do this, it'll interfere with our treatment. And the opposite is true. The opposite is true because not only does vitamin D help you to survive, if someone has cancer and it helps you to survive. But listen to the second part of the study. And it's something I've said for, it seems like 100 years. It's only been 50, okay? Vitamin D reduces the side effects of cancer treatments. Vitamin D helps you to survive cancer. It helps you to prevent cancer too. But I'm only talking about this study that shows that vitamin D decreases your side effects from cancer treatments, radiation, chemotherapy, surgery. Your side effects are reduced by vitamin D. Well, it's a tremendous anti-inflammatory, plus it boosts your immune system. Your immune system is made up of a lot of things, guys. One of them is detoxing. So vitamin D helps with that. And by the way, I brought this to you on other programs. So does probiotics. Like, guys, if you have any loved ones, anybody that will listen to you even for a couple of minutes, and they got cancer, you want them on vitamin D and probiotics. I actually had, what's the balloons coming? I put my finger up. I've had people, okay, tell me that their oncologist told them to stop taking probiotics. It might interfere with the treatment. No, it doesn't. No, it doesn't. It just decreases side effects. Plus, it actually makes the treatment more effective. I've shown studies to patients in the past. Show this to your oncologist. I get a migraine. They're so concerned. They're giving you like poison as a treatment. And then they're worried about, well, probiotics just might help. No, they don't say that. That might hinder my treatment. Are you kidding me? Anyway, okay, here's the study. Another study on vitamin D. It increases the survival rate of people with cancer, and it reduces side effects of cancer treatment. And so do probiotics. Okay, let's get back. That was study number 1 and 2. Study number 3, Canadian study shows women with the most menopausal symptoms had greater cognitive impairment later in life. The connection between imbalanced hormones and the brain. Okay? Now, guys, you know I have been talking about hormones for a long time, right? In my office, I was a hormone doctor. And by the way, in case you're wondering, insulin is a hormone, okay? Insulin's a hormone, okay? But so is estrogen. And we live in an estrogen-dominated world. Now, I understand when physicians say, well, if you're getting menopausal symptoms, again, did I put my thumbs up or no? I didn't. Oh, anyway, guys, I know doctors say this, and I get it. I understand what they're saying, okay? Well, Dr. Martin, when a woman goes through menopause and gets menopausal symptoms, their estrogen comes down. Yes, okay, I know that. So we like to give them estrogen therapy. I don't like that. I've always been against that. I don't even believe in bioidentical estrogen. Because I got good results with patients when I balanced their hormones. I was never so much worried about giving them estrogen, I was actually getting them to decrease their estrogen. And guys, I used to test estrogen. People, yeah, they seem to have low serum estrogen, but they had estrogen. Remember, I used to do a scan looking for estrogen. And my word, I wish they did that scan. It should be compulsory for women. Doctor said, I'm low in estrogen. I said, look at the scan. You got estrogen coming out your both ears, on your breast tissue, all over your chest wall. You don't want to be taking estrogen. You want to be lowering your estrogen and elevating your progesterone. You want to balance those hormones. Okay? Balance them. Okay. They understood that. And I get the results. And, you know, I don't have my scans in front of me, but I'll find them. Okay? So I can show you that. I've shown it to you in the past. Okay. Canadian study shows women with the most menopausal symptoms had greater cognitive impairment later in life. Guys, this is why I talk to you about flax seeds. Flax seeds have lignans, and they have the most lignans of any seed or any food in the world. And you want to block extra estrogen. I don't want you not to have estrogen. I just don't want you to have any extra estrogen. And our menopausal formula, for example, is meant to elevate your progesterone and dim, we put dim right in it, to dim out your estrogen. Balance it. Okay. Now, Canadian study shows, and why would that be? What effect would it have on the brain? Well, there's a lot of different reasons for that. I think one of the reasons is when you have estrogen dominance compared to progesterone, your thyroid is messed up. And that'll slow your thyroid to a crawl. Okay? Now, here's another one. Okay, this is another study. A daily multivitamin actually reverses brain aging. Now, guys, if you've been around me for any length of time, most multivitamins I wouldn't touch with a 100-foot pole. I mean, to me, and I you know me, doctors say this, but I don't. But I will today. A lot of times, you're not even absorbing half those vitamins. This is why I like our liquid multi. Okay? We used to call it blood boost. Because I literally could show patients their ferritin, their B12, their, if they were borderline anemia or whatever. I used to be able to show patients, I could raise their blood levels and we called it blood boost. And then, well, Health Canada said, stop calling it blood boost. Okay. And we call it multi-nutrient, I tell you, multivitamin. But it does show that it will help reverses brain aging. You know what, guys? Very, very interested in brain, memory, especially the hippocampus, whatever you want to call it, campus. All I remember is campus. The memory center. Boy, I want to protect that. Don't you? Don't you? It's one of our greatest concerns as we get older. Memory. Okay, well, the multi-nutrient helps. Here's me for my memory. Okay, I'm big on this. For my memory. High DHA. Your brain is made up of DHA fat, You want that fat in your brain. I love DHA. I love Navitol because it crosses the blood-brain barrier and it increases nitric oxide. Nitric oxide helps the blood vessels in your brain. Well, it helps your blood vessels everywhere with microcirculation. It opens up your blood vessels. Very, very important. Okay? Here's the headline: a daily multi actually reverses brain aging. Okay. I like it. Get a good one. Okay. Here's one. Screen time. Okay, we know what that is. I kind of laugh at myself because I never thought that I would use a phone as much as I use a phone today. Okay? Too much screen time. Okay? Really. But all my studies come there. Okay? And it's amazing to me. Okay? But one thing this study is saying is turn your phone off at night. Okay? Because it says screen time. Scrolling in bed increases your chances of insomnia by 59%. See, they can actually measure that. Okay, one thing they can do now is measure sleep. Sleep testing has become famous because of sleep apnea. Can I tell you something? When I graduated in the 1970s, what was sleep apnea? I never heard of it. I mean it. Today it's like an epidemic. Every second person or more has some form of sleep apnea. That's scary to me. And we all know that sleep is important, okay? For a lot of things, your immune system, your lymphatics, your brain has its own self-cleaning oven. It only works when you're sleeping. And it doesn't work when you're sedated. So don't sedate yourself. If you can, please. Okay? Your brain doesn't go into the self-cleaning mode. So, screen time. Scrolling in bed. I've done that a few times. I admit I'm guilty. I don't do it a lot, but I shouldn't do it at all. It increases your chances of insomnia by 59%. And it chops, okay, this is the article. It chops 24 minutes off your nightly sleep. Well, I don't know if that seems like a long time to you, but you need every bit of sleep. Sun, steak, steal, and sleep. Okay? Sun, steak, steal, and sleep. Okay. Okay, let's end it there today, guys. We're having fun. I got a few more studies here. Yeah, I do. But we'll hit those this week. Now remember, Q&A Fridays. Send your questions in to info@martinclinic.com. info@martinclinic.com. Guys, I don't know if I told you lately how much I love this audience and I love you folks. If you're not a member of our private Facebook group, remember, you got to get on there. I think we got almost 22,000 members of our private Facebook group. We got 89,500 followers on Facebook. Okay? Well, you'll notice something. Well, I don't know if you notice, but I see the numbers. We're 254 live, down to 250 now. People are tuning out. You know what? By lunch, by noon today, we'll be well over 2,000 or 3,000 views on the Facebook. And then, of course, these things are turned in to the doctors in podcasts. Guys, you're the ones that made this successful. Okay? So thank you for that. We appreciate it. What can we do without you? Okay. Give us your feedback. We love you. We'll talk to you soon.